The U.S. is set to officially exit the World Health Organization today after President Trump gave notice on the first day of his presidency in 2025 via an executive order. Joining us now to discuss this is Reggie Littlejohn, founder and president of Women's Rights Without Frontiers and a human rights advocate. Reggie, thank you so much for joining us today. So what was going through your mind initially when you first heard this move by President Trump?
Oh, well, I had gone to DC for the inauguration, and I expected him to keep his promise to withdraw from the WHO. I was really surprised and obviously thrilled that he did it on his first day in office, just within hours of the inauguration. So it was a moment of great triumph and jubilation for those of us who had worked so hard to help bring that day about.
Okay, maybe you can dive a bit deeper into exactly why you were feeling these emotions. What are the motivating factors that led to you feeling this way?
As you know, I began with Women's Rights Without Frontiers fighting forced abortion in China. When the World Health Organization started following China's lead on COVID, I saw that basically that they were installing a network of vaccine passports, which could serve as the same platform as the China social credit system, which would put the entire world in a situation of mass surveillance and totalitarian control. They also mimicked China's lies, that there was no human to human transmission. They followed China's lead in terms of lockdowns, vaccine mandates, mask mandates. They basically botched the entire COVID response and arguably caused many lives all over the world. And so then their result, what they wanted for that is they were like, well, we didn't have enough power. So they did these amendments to the international health regulations, this pandemic treaty to give themselves more power. And it was time to get out. I mean, uh, Trump cited the corruption of the Chinese Communist Party having an outsized influence on the World Health Organization, their botched COVID. Also, I would say this whole push towards digital IDs is something that is extremely dangerous. And then they have this new thing called the pathogen access and benefit sharing system, where they are encouraging countries instead of to quarantine off the deadly pathogens that they might find in their jungle or in their swamp to send them to the World Health Organization, and then the World Health Organization will then farm them out to labs all over the world, ostensibly to make vaccines. But what this does is it greatly increases the chances of lab leaks and even bioterrorist attacks. There is no prohibition against gain of function in the pandemic treaty. And so I am absolutely jubilant that the United States now has officially withdrawn, and I would encourage other countries to consider doing the same.
So you talk about China's influence in the WHO. Do you think public perception and world leaders' perception took a more critical view right after the pandemic and what you described about China's influence?
I think that it became obvious to anyone who had eyes to see that that China, for example, really restricted the way that the World Health Organization could even investigate whether this was a lab leak. China's line was, "This is not a lab leak. It was, the Wuhan wet market, pangolin or a bat." And then what the World Health Organization did is it shut, and also governments and social media shut down people who disagreed with that, calling it misinformation and disinformation. When actually now it turns out that that is likely what happened. And this is another problem with the World Health Organization that is similar to the Chinese Communist Party, is that is this regime of censorship. The pandemic treaty requires governments to prevent misinformation and disinformation. It means you don't even censor it afterwards, you prevent it from coming out to begin with. This is very CCP like and very dangerous for the world.
So, Reggie, the U.S. was the main funder of the WHO, contributing around 18% of its overall funding. What's going to happen for the organization without that money?
Well, first of all, okay, so we withdrew our funding. That's a huge financial hit for them. Other organizations have stepped up. Some governments have stepped up, but they have not been able to replace the funding by the United States. And what that would mean to me is that it signals to the World Health Organization that, in fact, the world does not value its services as much as they think it should. But the United States has said that we want to collaborate bilaterally with other countries, and so that if a country wants to coordinate with us, I'm sure that we will help them, not through the WHO but directly. So that's I don't think that we're just leaving the world in a state of pandemic unpreparedness or whatever, but we just want to be able to direct our actions and our funding as a sovereign nation.
Yeah, you're right about that. And I just want to build on it because the US and Argentina, they've announced that they're going to create an alternative international health system separate from the World Health Organization. What do you think about that?
Well, I'm not sure if that's going to be an actual structure. The problem with creating another structure like the World Health Organization is that if it's successful, it's just going to get infiltrated the way the World Health Organization did. So I'm not sure it's going to be another structure or whether it's just going to be bilateral, ad hoc negotiations. Somebody has a problem, the United States, can work with them to help their problem, and not necessarily through another organization.
Okay, just one final question, Reggie. The U.S. has a number of allies. They don't necessarily always follow suit in what the U.S. does. But do you think other countries may follow in the footsteps of the U.S. in leaving the WHO?
Well, I know I spoke recently at the Israeli Knesset. I know that they are discussing it. And I'm going to be going to Europe next month and speaking to parliaments, hopefully all over Europe about issues like this, trying to encourage people to really think about, does it make sense to stay in this corrupt and ineffective World Health Organization?
Okay, Reggie, really great to speak with you today. Thank you for your time.
Thank you.